you talk about personal stories, Gary. I am definitely somebody who I would describe myself as a foodie, right? I learned to cook when I was 16. My dad taught me to cook. I was famous in Edinburgh Medical School for cooking the best Indian chicken curry. Would have schools of people coming around.
I love Indian food. I like the butter chicken. That's my favorite.
So I had an interest in food myself anyway.
Yeah.
And I was thinking when I was working on calls in the hospital, I was like, the food that was available wasn't the most nutritious. And yet, half of the staff, half of the NHS employees now, and I'm sure the figures are probably similar in the United States, are overweight or obese, right? So I was thinking there's definitely something going wrong with the food environment here. So the next day, after this patient story, after I, had this conversation with the patient, I thought, somebody that had inspired me at that point, who I thought was really, doing his best to help tackle child obesity, was Jamie Oliver, the celebrity chef.
Yes.
And I had a friend of mine who worked for the Times at the time, newspaper, and I asked her, do you have the email address for Jamie or his PA? And said, sure, why do you want it? I said, well, I think he's done great work on highlighting the problems with school food, right? Mm-hmm. Children's food.
Huge issue.
He should get involved in a campaign to improve hospital food. So I wrote this email one afternoon in my lunch break. Didn't expect a reply. And then 6 weeks later, I get a reply from his PA saying, "Dear Asim, thank you for contacting us." I said to him, you've done so much great work and hospital food is full of junk. And he said, "Jamie would be thrilled to meet you. Please come and meet him on this date and we can have a talk and bring some other doctors together." So when that happened, I'm someone, Gary, that's always enjoyed writing. My dad was a prolific writer. I think maybe I got those genes from him, about NHS stuff and medical politics.
Wow.
And I started writing when I was at, my school, which was a very prestigious school in the UK. I started writing articles when I was 16 for the school newspaper. We won national awards for that. Mm-hmm. So I had this kind of, I think, interest in writing. Mm-hmm. And I'd written some articles for The Guardian before about junior doctors and medical training. So I'm going to meet Jamie, and I get introduced to the health editor of The Guardian newspaper over a dinner. And he said, "This sounds like a really good story," but he says, "It sounds like a great campaign The Guardian newspaper can get behind, like improving hospital food," right?
Wow.
As almost like one of the ways to highlight and tackle the obesity epidemic, We've got this obesity epidemic, but we're selling junk food in the hospital grounds. That doesn't make any sense, right? We have to start in our own backyard in terms of the health profession. So I went to meet Jamie, and he said, in the end, what happened was The Guardian didn't start a campaign, but he says, "Listen, why don't you write an article? I can have a look at it and pitch it, to The Guardian or the Observer newspaper." So I wrote this article about my meeting with Jamie. Jamie said, "Asim, listen, I'm very much behind what you're doing." But he had so many things going on. I think he was going to Australia for a different campaign. He said, "Listen, I can give you a supportive quote, but I can't get involved in a campaign right now." So I wrote this article, and suddenly it becomes, I think this was February 2011, it becomes a front page commentary of the Observer newspaper, which is a huge impact newspaper in the UK.
Wow.
And it was called "I Mend Hearts, Then I See Our Hospitals Serve Junk Food to My Patients." And then
I see hospitals serve junk food to our patients.
So that's where things really took off for me in terms of getting into the public sphere.
Yeah.
And that was really a moment where I got really, went down the track of looking into really the root cause of the obesity epidemic. How, as you know very well, Gary, for a very long time, how we got the dietary guidelines wrong.
Right.
How there was an oversupply of excess sugar. And then I was involved with the BMJ in writing articles to really expose and bring it to the mainstream.
Right.
That sugar was a major issue.
The British Medical Journal, which is a very prestigious journal, New England Journal of Medicine, a very, very prestigious journal. I remember, in the documentary, you begin to go against the grain, which is very interesting because, my audience knows I come from a big data background, and I'm not licensed to practice medicine like you are. I have all the respect in the world for people that are. But during my career in mortality, we used large data as a predictor of mortality. And in these large data pools, we were finding, lots of trends that were not at all what you would hear in the mainstream. They were not being echoed in mainstream medicine. So, high LDL cholesterol is, this major risk factor for cardiovascular disease. We need to, the lower the better for LDL cholesterol. But then we had mortality data that was the polar opposite, and not an insignificant amount of mortality data. Mortality data on, in some cases, hundreds of millions of lives. And so we actually knew that the opposite was true, that actually people that had lower levels of triglyceride and healthy HDL and still had elevated, what you would consider clinically elevated levels of LDL cholesterol, were actually living longer.
Yeah.
And we were seeing less reporting of things like hormone disruption, D3 deficiency, muscular pain, chronic fatigue, complaints of brain fog, things like that, that you would think were the opposite based on what was going on in the literature. And I certainly wasn't qualified to comment on that. I wasn't, out there on the front lines like you were. But, you noticed this trend too. I mean, you've published papers on it and written about it, and even been crucified for it. And I want to walk people through this obsession with randomized clinical trials that we seem to have built an entire medical system on. Because another fascinating point that I've seen echoed in your work, in Casey Means and Callie Means' work, I think the world of that brother and sister combo, is that we're not actually seeing all of the data. Yeah. The data is seen by a very, very, very small group of people. And that small group of people then goes and says, here's what's in the data. I think the analogy used in your documentary was, I'm going to look through the telescope and then I'm just going to tell you guys what I see. And then you go tell the world, but I'm not letting anybody else look in the telescope. And talk a little bit about that, because for the people that are not in the know, even for physicians, even myself that spent 20 years in that space, I did not know that data was, not really being made available.
Yeah, no, it's a really, really good point you raised, Gary. So we go back to square one for the layperson, and this may surprise a lot of people. Medicine itself is not an exact science. It's not like physics or chemistry. It's a social science, a science of human beings. It's constantly evolving. And in fact, the father of the evidence-based medicine movement, Professor David Sackett, Canadian epidemiologist, actually said that, and this is actually true, this is being